I think one of the biggest challenges initially was trying to work out how we could ensure that we were still there for our patients despite everything else that was going on. Obviously that was in the context of our own staff, the insecurities around what that would mean for them, the anxiety around family members, the very real challenges that we're faced with, things like having the right equipment to potentially work differently. Although we didn't see an increase in volume initially in terms of the young people coming through, what we did see was young people coming through who actually had much more significant need. So the complexity, if you like, of need from our young people was increased quite significantly throughout the pandemic. Gosh, I am so proud of what we were able to achieve in a very short period of time. I think the first thing to say is that notwithstanding the incredible challenges that the teams were under, as I mentioned, we sometimes forget that our staff are both healthcare professionals but also ultimately people with their own anxieties, with their own worries, with their own concerns about, you know, their children being at school or their elderly parent or their own health conditions. But almost overnight we were able to change our delivery model such that we never shut any part of our service. And in fact, throughout the pandemic, we increased our capacity by about 10%. And that was as a result of converting what would traditionally be face-to-face appointments to more virtual, whether that be over the phone or preferably over video conferencing. Obviously, we were also providing face-to-face where it was required. And again, you know, so proud of the staff who essentially put themselves potentially in harm's way with PPE, yes, but nevertheless going into the unknown really in terms of being there for young people in crisis. It was absolutely remarkable response. I think that the first few weeks, I think the way that we responded, we essentially changed our model of delivery overnight, near enough, which, you know, is no small thing in terms of ensuring that we were still providing a clinically safe service, a service that would meet the needs of young people. And it's fair to say that there are some things that we could have done differently, but for me that immediate shift, the way everybody sort of recognised that actually closing our services weren't an option. You know, our young people continue to need us possibly more than ever. And the way that everybody came together, worked together to ensure that we were there for the young people that needed us, I think sticks with me. That some of the digital helplines that we've put in place, so Coot working with the council, we've done a lot of work with Birmingham Children's Trust, which I'd want to build on in terms of our support to schools. You know, we had the You've Been Missed campaign, which our stick team were instrumental in delivering, which I think made a real difference to how teachers in particular, parents also felt supported as their children went back to school after a long period away. I think that the pandemic has forced us to think about our provision in a very different manner, which in the long term I think will be really positive. I think that it's given us more of an impetus to think about things like race, think about whether actually the services that we provide are truly meeting the needs of the young people that we're here to care for. And I think, I wouldn't say that it wouldn't happen if it wasn't for the pandemic, but I think that's really sped through necessity. So I think the response to mental health has been truly incredible. I couldn't be prouder of people that I work with. I'm not sure any one person could have given a drop more than they did. And, you know, I think that this isn't about me ultimately. I think the young people of Birmingham can be truly proud of the people that are there doing their best to provide them with the mental health support that they need. It's a challenging time, of course it is. You know, in that context, I recognise there are things that we always want to think about being better, you know, and we'll never sit still and say, you know, we've cracked it. But the reality is, given the circumstances that people have had to work with over the last year or so, they've been absolutely magnificent.